Psychopathy is used to describe a type of personality in which a person exhibits coldness, lack of emotion, indifference, and a tendency toward antisocial behavior. Individuals with psychopathic traits are at a higher risk of engaging in violent and criminal acts. However, not everyone with these traits is a criminal. Psychopathy shares many overlapping characteristics with antisocial personality disorder. Psychopathy is often regarded as a more severe form, or one that places greater emphasis on the emotional aspects, callousness and lack of conscience. Whereas antisocial personality disorder focuses more on specific behaviors. Not every person with psychopathic traits is the same. Each individual has unique actions or thought patterns. Some may be sex offenders or murderers, while others may become successful leaders. People with psychopathic traits commonly show the following manifestations, though not everyone exhibits all of them. 1. Antisocial behavior, disregard for rules and laws, and a tendency to commit criminal acts. 2. Narcissism, also known as excessive self-love. These individuals often live by their own rules, believe that everything should revolve around them, prioritize themselves, and do not consider others. 3. Superficiality. This refers to saying or doing things solely because they are well received by others, rather than out of genuine belief or desire. Outwardly, they often appear highly charming, confident, and engaging in conversation, making it easy to win people over. As a result, their relationships tend to be very shallow and insincere. 4. Impulsive actions and lack of forethought. 5. A cold and unemotional personality. 6. Absence of guilt. They feel no remorse after harming others or causing someone pain. They do not care about how their behavior affects other people. 7. Indifference and lack of empathy. They have difficulty understanding others and show no concern for whether someone feels fear, sadness, or anxiety. They are incapable of truly loving someone and lack the normal emotions of an ordinary person. 8. Frequent lying, which resembles a disorder rather than a mere habit. Psychopaths often lie to manipulate others psychologically. They lie easily, use aliases, deceive, or exploit people for personal gain or pleasure. 9. Manipulation and the ability to make others act according to their will. 10. Parasitic lifestyle. They take advantage of others' kindness or depend financially on other people. These characteristics can appear from childhood and worsen over time. The characteristics and causes of psychopathy have been primarily studied based on the Psychopathy Checklist-Revised, PCL-R, developed by Robert Hare, currently considered the gold standard assessment tool. Psychopathy is not an official diagnosis in the DSM-5, but the PCL-R measures a stable cluster of personality traits that include both emotional and behavioral aspects. Characteristics of psychopathy. According to the four-factor model of the PCL-R consists of 20 items divided into 4 main facets. Total scores range from 0 to 40. A score of 30 or higher is generally considered the high threshold in North American research, though this cutoff may vary across cultures. A. Interpersonal factor, how they treat others, glibness/superficial charm. They speak in an engaging, confident manner and easily win people over from the first meeting. This serves as a mask for manipulation. Grandiose sense of self-worth. They believe they are superior, special, and entitled to preferential treatment. Pathological lying. They lie easily and frequently, even when unnecessary. Conning/manipulative. They use charm, intelligence, or words to control and exploit others for personal gain. B. Affective factor, the core of callousness. This factor is regarded by many experts as the most central characteristic. Lack of remorse or guilt. They feel no distress after causing harm and may rationalize their actions. They deserved it. Shallow affect. Emotional expressions are limited, artificial, or short-lived. They struggle to sustain deep emotions. Callous/lack of empathy. They cannot feel the pain of others. They understand it intellectually, but experience no emotional response. Failure to accept responsibility. They consistently blame circumstances or other people. C. Lifestyle factor: need for stimulation/proneness to boredom. Parasitic lifestyle: living off others. Lack of realistic long-term goals. High impulsivity and irresponsibility, frequent changes in jobs and relationships, failure to keep financial commitments. D. Antisocial factor: poor behavioral controls, easily angered and prone to violence. Early behavioral problems, signs appearing before ages 12-15, juvenile delinquency. The interpersonal plus affective factors are commonly referred to as factor 1, while the lifestyle plus antisocial factors form factor 2. Factor 1 is more strongly associated with primary psychopathy, whereas factor 2 is closer to antisocial personality disorder. Causes a complex interaction between genetics and environment. There is no single psychopathy gene. It results from gene-environment interactions and multiple neurodevelopmental factors. A. Genetic factors: heritability approximately 40-60%, twin, and adoption studies show that callous unemotional traits in children have high heritability, possibly up to 60-80% in some studies. Commonly associated genes include the low-activity variant of the MAOA gene, sometimes called the warrior gene, especially when combined with childhood abuse. The serotonin system, 5-HTT, and the dopamine system, DRD2, DRD4, DAT1. Polygenic nature: hundreds of small effect genes contribute, rather than a single gene. B. Neurobiological factors: amygdala, the region processing fear and emotion. Reduced activity: diminished ability to perceive others' fear and form empathy. Prefrontal cortex, particularly the orbitofrontal region, reduced function: poor impulse control and decision-making. Some studies report a larger striatum volume, related to reward-seeking and stimulation. Low resting heart rate and reduced physiological response to threat stimuli, low arousal. C. Environmental factors: physical/sexual abuse, emotional neglect, inconsistent parenting, or family violence during childhood. Impoverished environments, early exposure to crime, or highly competitive settings. Conduct disorder before age 15 is a nearly essential precursor for diagnosing antisocial personality disorder in adulthood. D. Distinction between primary and secondary psychopathy: primary, primarily genetic, low anxiety, innate coldness. Can appear even in a good environment. Secondary, more trauma-driven, higher anxiety and intense but distorted emotional reactions. Not everyone with genetic risk factors develops psychopathy, and not everyone who experiences childhood abuse develops these traits. The environment can either amplify or reduce the expression of genetic predispositions. The clearest manifestation of psychopathy lies in the emotional domain: lack of empathy and lack of remorse, while antisocial behavior is the outward expression. The causes involve a complex combination of genetics, brain development, and environment, not simply born that way or solely the result of poor upbringing.